because it's a minute past noon, and I would like to welcome everyone very much. My name is Darren Mitchell. I'm not sure, you may see Noah Fuentes under my name, but it's actually Darren Mitchell. I needed to use his account to get in, and I'm going to be helping with this session. So feel free to message me if anything comes up, if you have any questions or need any information. And I am so glad that you were able to join us. If you have any trouble technically or whatever, remember there's a help desk available to you, or you can message me if you'd like. And I'm going to, I don't want to spend any time talking about this stuff. That takes away from Karen and her presentation. So I'm going to turn it over to Karen Coleman to talk to us about mental health awareness for the workplace. And she's going to go ahead and introduce herself and get started. So thank you so much.
Thank you, Darren. My name is Karen Coleman. I am a mental health first aid outreach specialist. I work for the Center for Healthcare Service Foundation. So we support different programs at the center, which is the local mental health authority here for Bexar County. And I'm here to talk to you about one of our resources that we have available, not just to you, but to also the community as well. So I'd like to start off by watching a video that I generally introduce you to that kind of puts things into perspective as to why we're here today. So I'm going to go ahead and play this video.
I'm Danny. I've lived with depression and anxiety for about 12 years. And today I'm going to be opening up about those mental health challenges with some complete strangers in the hopes that we can start normalizing conversations about mental health. Hi, I'm Danny. Nice to meet you. I'm Coleman. It's nice to meet you too.
Cecilio, nice to meet you.
How are you?
Doing well, thank you.
I'm doing really good. Yeah.
Doing good. Yourself?
I'm actually not doing so well today.
Okay, that's honest.
Oh, sorry.
Okay. So.
Okay. Okay. What's going on?
Can you tell me a little bit more about it? Do you feel comfortable talking about it, or?
Yeah, I can talk about it. So I've been living with depression for a long time, and this week has been particularly hard. So a lot of people simply just don't know what to say and what to do when somebody opens up to them about a mental health or addiction challenge. And that's really where mental health first aid can be valuable. It teaches people a concrete action plan for starting a conversation and getting somebody the support that they need, whether that's treatment or just a non-judgmental listening ear. So was it a little unexpected when I responded that I wasn't doing well, us being complete strangers until this moment?
I'll be honest, it caught me off guard. You just expect the automatic response of, how are you doing? I'm good.
When you first meet someone, here there's like a huge distance.
I always feel like, how can I help someone else? So, and I know it's hard because you just want to be like, oh, sorry, okay, let me run,
And I don't think people do it because they're inconsiderate. I think it's because they honestly just don't know what to say.
Have you talked to anyone about this? Sometimes they just don't want to burden. Yeah, I know it feels like that, but most of the time people want to help. Like everyone kind of wants to be useful to other people, so they want to help you. So I don't feel like you're burdening them. I like totally wanted to give you a hug, and then I was like, that might be weird, but okay. No, that was like exactly like what you should have said.
Myself, I was thinking like, okay, this person is in need of help. You try your best. Listen to them. Sometimes that's the best thing you can do is just listen.
Yeah, if you had answer, you wouldn't just try to you wouldn't will yourself to get better with that. And so I hope that people just start talking about it more. Wouldn't it be refreshing if we could take off the mask?
Yes, absolutely. Be real people.
So how did you learn how to respond that way? My father committed suicide when I was young, and it was like a really pivotal change. And I think I spent most of my life trying to avoid that and avoid talking about that and like the shame and the guilt. So I really made this decision to like learn how to interact with people and be empathetic and show people that someone does care about me if I don't know you. I think people should just ask more questions, because it's like once you get to know the person and understand that it could literally be any of us, like any of us could have this at any point in our lives. It just, how could you make a judgment on it? I give you a hug. Well, absolutely. All right, next. Thank you.
So the truth of the matter is, many of us don't really know how to have a conversation around mental health and mental wellness. And since many of us don't know how to do that and do so very well, that's why we created, this resource that's available to the community. You'll notice that a lot of times people respond very differently. Many of us will kind of just, sit there and be like, oh, some of us don't know what that follow-up question should look like. So really this video is intended to help us kind of understand how many of us are not necessarily prepared to respond when someone tells us that they're not actually doing well. So we want to make sure that we let everybody know about mental health first aid and how it can help you be prepared and definitely be confident enough to not just notice, but also know how to respond to these questions when, or these answers when someone tells you that they're not necessarily doing okay. So what I want you to do is I want you to think about how you responded previously when someone tells you that they're not doing okay, whether it's a coworker, whether it's, someone in your circle, a family member. What has your response previously kind of looked like? Were you able to, do you know what to do, what to say? Are you able to recognize when somebody is struggling? Because the truth is that many of us are struggling. um, some of us in silence, some of us, people aren't necessarily able to recognize that we're struggling because we're high performers. So I just want you to kind of start thinking about what that has looked like before. How have you responded to previously? So when we talk about mental health at work, we know that early intervention is very critical. The earlier and the sooner we get people connected to the resources, the better the outcome will be for that individual. So I want to ask you, in your workplace or in your environments, are you comfortable in, discussing about mental health concerns without necessarily having a fear of discrimination? Because we know stigma is still, it's still here with us. So are you comfortable telling, your supervisor or someone, that might be in charge, like, hey, I'm not having a good day today. I really need a little bit of help. Do your employers or employees check in on individuals who may be struggling, or do we just avoid having that conversation altogether? And what does that work-life balance strategy look like? So just think about that in our work environments, in our everyday lives, what does that look like? Because many of us spend a lot of time at work, not just in our homes, but really at work. So we know that there's a lot of reasons why employers are kind of still missing that mark. And here we've highlighted, research. A study was conducted back in June and July of this year. And these were some of the, reasons that they kind of came up with that are still, employers are still making mistakes, ignoring mental health conditions. We're not necessarily, talking about it because we don't know how to have those conversations. There's also number two is discriminating against employees with mental health conditions. So if we're discriminating, how do we expect people to kind of come to us and say, hey, today's just not a good day for me? And then, of course, lacking that open discussion and transparency about mental health. How many times, are you able to say, hey, you know what? I think this Friday I'm going to take a mental health day. I just need, a little bit of self-care without necessarily having someone look at you in a certain type of way. Number four is failing to identify employees' mental health needs. What do our employees, what do people need from us? How could we better support our, not just our employees, but really our family members, anybody in the community who's struggling? Number 5 is overloading employees with excessive work tasks. We live in a world where numbers are so critical and so important. Number 6, missing to test employees' awareness of mental health. Do we know if and when they're struggling? Do we know when to, do we know that they are aware of the resources that are out there in our community? Are they aware of, calling 988 if they have a mental health challenge? And then, of course, these are really the 6 reasons why employers are still missing that mark, according to that study that was done earlier on this year. So next time you're in a room, and I think, if I'm not mistaken, there's over like 50 people in this, in this session, take some time and look around when you walk into a space. 1 in 5 Americans are struggling with a mental health challenge. So if you walk into a room, start counting 1 through 3, 4, 4, 5, more than likely you're going to have different people, several people in one space that are struggling with a mental health challenge. And when we talk about 1 in 5, I always like to emphasize that really is 1 in 5 that have truly been identified and diagnosed. Think about those people that don't necessarily get the help they need right away. So that number probably is a little bit higher than 1 in 5. However, a lot of people, like I said earlier, are still suffering in silence and not getting the help that they need. So here's some other astonishing numbers. Mental health, we know that depression is the leading cause of disability worldwide. And to be honest, between 80 to 90% of people with depression have a positive outcome with treatment. So again, if we could just get people connected to the resources that they need, they can have a good, robust life. Then the other one that I like to point out is as many as 35 million work days are lost each year due to mental illness. Because if I'm not feeling good, sometimes I might just call in to work and say, hey, I'm not coming in today. Or untreated mental illness in the workplace costs businesses $105 billion each year, mostly due to a loss of productivity. Because if I'm struggling at work, more than likely I'm just showing up and I'm just kind of going through the motions. I'm not necessarily being productive or given the best of my ability, but I'm just there. So a lot of businesses are losing out on productivity hours. So we asked the questions, how can we better support the mental health of our individuals in our work environments? And of course, that's why mental health awareness training in the workplace becomes very important. We want to make sure that we reduce not just the stigma, but we want to educate individuals and increase their ability in mental health and substance use literacy. What language is appropriate to use when we're having these conversations? Because if we increase the language and we educate individuals, then more than likely they'll be able to connect people and be confident about having these difficult conversations around mental health or even a substance use challenge. And then, of course, it teaches employees how to connect to a distressed person with the appropriate resource. If I have somebody, if I'm helping my coworker, or it could be someone that comes in to get services. If I'm helping them, more than likely I'm gonna know what resources to connect them to so they can get the help they need. So it's very important that we educate ourselves. Mental health first aid truly teaches you the initial help to give an injured person, or actually first aid does that. First aid course teaches you how to connect and give a person who's injured that initial help until professionals come into that scene, right? So this is the same thing with mental health first aid. Mental health first aid is the initial help that we might give someone who's experiencing a mental health challenge. And it provides that person, those tools that they need to recognize those early warning signs, maybe when things are kind of worsening, or sometimes even during a crisis situation. So just as first aid course, doesn't teach you how to necessarily perform a heart surgery, mental health first aid will not teach you how to provide professional or treatment. So we're not teaching you how to become a therapist. We're teaching you how to recognize signs and symptoms and how to get people connected to the resource that they need. So again, some of the topics that we cover during mental health first aid is we talk about what those risk factors and those warning signs of mental health challenges. We provide you just general information over some of the most common terms and common diagnosis disorders that there are. So we talk about depression, anxiety, of course, trauma, how to help someone who might be in a psychotic mode. So we talk about what psychosis looks like and how to look at what those signs look like. And then, of course, how to help someone who's, experiencing a substance use challenge. Then we offer a 5-step action plan on how to navigate through this conversation. And then, of course, we provide you with professional, peer, and self help resources that you can, of course, add to your tool belt to assist the individuals that you're trying to help in a better way. So I'm going to introduce you to ALGAE. So ALGAE is actually the 5-step action plan that you will learn during the mental health first aid training. And you see the little koala bear right next to the action plan because ALGAE is actually also the name of the mascot for mental health first aid. So whenever you see anything with mental health first aid, sometimes we associate it with the mascot, which is ALGAE. So ALGAE is approach is our big A. Listen non-judgmentally is our L. G is give reassurance and information. Our first E is encourage appropriate professional help. And then our second E is encourage self-help and other support strategies. So during the training, we really emphasize and kind of go through each of these steps, what it looks like, some things to kind of do and not do, but more importantly, how to apply it when you're dealing with somebody in a non-crisis situation and how to apply it when you're dealing with someone in a crisis situation. And when I teach the action plan, one of the things that that I like to emphasize is that it's a non-linear plan. And I always tell the little backstory. So when mental health first aid was brought to the US, because it's originally from Australia. So that's why the koala kind of stuck. But when mental health first aid was brought to the US, they initially wanted to change the mascot from a koala to an eagle. And I always get that look like, what? I think, I do feel like the koala is more appropriate for mental health. However, if they would have went with the mascot to be an eagle, they still could have kept the same action plan because the same letters that spell out algae also spell out eagle. So that is one of the biggest things that we like for people to remember is that when we're talking about the action plan, it is a non-linear plan. So you technically don't have to start with the A, you don't have to go to the L, you won't even have to complete the full process. What happens is you're going to take whatever piece is appropriate to the person that you're trying to help. So if, maybe, Nikki comes to me and she's like, hey, I'm really struggling today and this is what's going on. I might be at listening non-judgmentally for a little while. And then as she tells me her story and what's going on, if she tells me something like, I've been doing some, very as she may put it in her words, something that's really been bothering me is that I'm having these challenges, and the only way that I deal with it is I do some self-harm. I'm cutting myself. And so what you would do is at that point you're like, well, there's not much that I can do for this person except to encourage them to appropriate professional help. So you may jump from listening non-judgmentally, and depending on what that person tells you, you might have to jump to encourage appropriate professional help. So that's kind of what we teach and how that looks like. But it is a non-linear plan that we want you to remember. The other component that we emphasize in our trainings is, because we are culture, all cultural beings. We're shaped by identities, our histories, our family, our values, any significant experiences that we may have had. Our culture is always going to play a significant impact on how we view not just our physical health, but also our mental health. And as mental health first aiders, we want to make sure that, you remember that it's important to the connection between health and culture. It's important that we take that into consideration, because really, if we want to support people, we want to support them from the space that they're in and the space that they occupy, not the cultural spaces that we occupy. So I always tell people, you want to meet people where they're at, not where you think they should be or not where you are, but you want to meet people where they're at. So we definitely have a conversation around culture. I always tell people, if my grandmother didn't believe in going, to see the doctor or, talking to a therapist, my mom probably doesn't believe in going to the doctor, which was probably passed on to me. And I may not believe in going to the doctor. So keep in mind that culture is always going to play a huge role. In San Antonio and in Texas, period, we also have to take into account the different cultures, not just ethnic wise, not just, age wise, but also different sides of town. I might live on the northeast side of town, but I work on the east side of town, and how things are done just on a different, different side of town is very different. So we want to make sure that we respect everyone's culture and differences. The other conversation that we have is, of course, we talk about stigma and how we can, eliminate stigma. One of the ways that we can eliminate stigma is, of course, by educating people on the language that we should use. And we teach about person first language. And what that means is that language is used to acknowledge that the mental health disorder or challenge that someone is facing is not as important as that person's individuality and humanity. So we want to make sure that we put an emphasis on that person first and not their diagnosis, not whatever they're challenged with. So we would say things like a person living with schizophrenia. We wouldn't say, oh, she's schizophrenic. We've all heard these terms. We would say a person without housing or a person in transition. We might use terms like a person diagnosed with bipolar disorder. And especially here in Texas, we oftentimes use a diagnosis as an adjective. There's plenty of times where we've used the term, Texas weather is so bipolar. If I'm somebody who has currently been diagnosed with a bipolar disorder and somebody says that, I'm not going to feel comfortable having that conversation with someone. So that's why it's critical that we are very mindful of the language that we use, not just in our everyday language, but also at work when we're cracking jokes, on social media, the things that we choose to share, the, jokes that we choose to, kind of laugh about. So just be very mindful of the language that you use. And the last one is a person who uses drugs. We've kind of gotten away from certain terms because we want to be more inclusive to where it's not, us versus them type of, situation. So we definitely do narrow down that person first language and how to change some of the terms that we use on a day-to-day basis. The other thing that we emphasize really, really, really a lot about in our trainings is self-care. Happens to be one of my favorite topics. I often say that I think that a lot of people have a misconception of what self-care should be. When we have the discussion in our trainings, a lot of people think that self-care should be something that's luxurious or something that takes us hours to do. So we educate you and we provide you a self-care action plan. And this is what it kind of looks like. SAMHSA provides us these 8 dimensions of wellness. So basically what they're saying is that there's these 8 areas that we can take some form of action to preserve or improve our own health. So during our trainings, we go through each of these domains and we think of creative ideas or something that we could do as an activity, as a self-care activity to take care of each of these domains. And as we go through them in our training, we come to find out that there's a lot of things that will kind of overlap, especially when we're talking about, maybe emotional. For emotional, someone might, want to watch movies or, Netflix. They might want to cry it out or talk to a trusted adult. And when we talk about maybe spiritual, that might also be the case for some of us. It may just be going outside to get some fresh air. It might be reading words of affirmation. When we talk about our physical, it might just be getting some sleep. For many of us, getting 8 hours of sleep might be a little bit hard. It might be eating a well-balanced meal or just taking a walk outside. So it's important, and I love this exercise because a lot of times some of our participants will get different ideas from each other. And they're like, oh yeah, I didn't think about that when it comes to self-care. Some of these activities might just take a few minutes. I might just go outside, or as I get home, just sit in my car for, 5-10 minutes before I walk into a house. Just to get that alone time before, especially when you have children, you take a little bit of breathing exercises or just a little bit of alone quiet time before you walk into a different space. So we definitely want to equip you with how to better take care of yourself, because I often say you can't pour from an empty cup. So if your cup is empty, you're really not good to anyone else. So you can only take care of somebody to the capacity that you're taking care of yourself. So we want to make sure that we start changing that around, and you know how to take care of yourself so that you can take better care of other people as well. So as we go through mental health first aid and getting people trained, I want you to understand that when we train businesses and organizations in any form of mental health awareness trainings, we're really better preparing the support that you offer, not just to each other, but also to the people, like I said, to the people that you serve. Managers and employees can foster a stigma and a safe environment because now we know what language to use. I always encourage, especially employers to, have check-ins. When you have meetings, ask people, hey, how are you feeling today? If somebody says, I'm just not having a good day this morning, I dropped my coffee, I almost got into a car accident, you can have somebody who can tag team and be like, well, hey, if you need a little bit of support, I can help you today, so you can get through the day. And then you're, of course, you're equipped to support the numerous of other partners and clients, because again, if we're having a good day and if we're feeling good, then we really can be good to other people. So after taking a mental health first aid training, about 3 months after you take your training, you'll receive a survey. And here are some of the results that we have received from some of the participants that have taken the training. One of the ones that I always, kind of bring to the attention is, 97% reported mental health first aid increased their ability to recognize signs and symptoms of mental illnesses. Because a lot of times, again, like I mentioned, we don't know what we're looking for. We don't know how to help. So this training definitely will change that. And then 96 reported mental health first aid increased their crisis intervention skills. because we teach you how to have that conversation when someone says, hey, I'm thinking about killing myself. What do you do when someone says that? So we want to make sure that we equip you with those questions and allow you to practice those, not just in the session, but even after, so you can feel comfortable in helping people. And then, of course, 95 reported mental health first aid increased their confidence to approach someone who might need help. Because now that we're trained and we know what language and what words and what phrases to use, we would definitely feel more comfortable in going to somebody, or asking somebody like, hey, are you struggling today? Or how are you today? And if they say they're not in a good place, we'll know how to respond to that question or to their response. So I'm going to play a little video. It's a little short snippet video.
I did it for my community. I did it for my congregation, for my family.
For the women diagnosed with breast cancer that I work with every day.
I am a retired marketing manager,
corrections officer,
social worker.
I'm a teacher.
I'm a realtor.
I'm a health coach.
I'm in a band. I'm a nurse.
Before taking the class, I was unprepared.
To help someone that might be experiencing a mental health crisis.
Someone struggling with depression,
Anxiety,
an eating disorder, schizophrenia,
Drug or alcohol overuse,
panic attack, or a traumatic event, suicidal thoughts, just when you're feeling blue,
or someone's just having a bad day.
it could be a coworker, a friend, a neighbor. It could be a client, a family member.
stranger.
Somebody in a coffee shop. It could be anyone.
I think a lot of people want to help and they just don't know how.
Now I have the knowledge to take action for someone who needs help.
I learned signs to look for.
I took away basic tools to help someone struggling.
And in that helping, you may be saving their life. Sometimes topics are scary or intimidating.
I learned to be more confident in asking the tough questions.
How to respond in situations. How to better support them. It's just how to listen.
Places to go to get professional help.
It is like CPR for the mind and soul.
So I've used it with friends and family. I use it with my church youth ministry.
I've used it with my daughter.
I use the training every day.
Either directly or indirectly every day.
Every day. Every day.
Learn the signs.
Get the tools.
Make a difference in someone's life.
I did it for.
So here are some of the courses that we offer, and a lot of people have questions on, how long they take. So I'm going to answer a couple of those questions. So we have adult mental health first aid. Adult mental health first aid is the curriculum for anyone who is working with other adults. Generally, that one takes a little bit longer. It could be anywhere between 6 to 6.5 hours. Mental health first aid, the adult one is offered virtually. If you decide to do it virtually, there is a 2-hour pre-work requirement prior to taking the actual live or virtual training. So that training will kind of be shortened a little bit because you're doing that 2-hour pre-work. It's also available in person. And of course, the blended option is if you want to do the pre-work, and then you could do either the live session in person or again, through a Zoom or through a virtual option. Then you have youth mental health first aid. So youth mental health first aid is for any adults that are working with adolescents or that youth population. That one is also available in virtual, in person, and blended. That one is generally 6 to 6.5 hours as well. It's shortened a little bit from the initial 8-hour course. But again, it's for any adults that are working with adolescents. Then you have teen mental health first aid. So teen mental health first aid is for any teens that are in the 10th, 11th, and 12th grade level. Teen mental health first aid has to run either through an ISD, so through a school system, or it can be also ran through a youth serving organization. So if you know any youth serving organizations that have that teen age group of 15 to 18, they could be trained in teen mental health first aid. The only requirement with teen mental health first aid is that we need to train 10% or higher of the actual adult population that are working with these teens. So what will happen is we're going to teach the teens how to recognize these signs and symptoms within themselves and their peers. And we also teach them of when it's important to get a trusted adult involved in that conversation. So it's important that we train the adults first before we have the teens coming to those trusted adults. That way everyone knows kind of what to do. We also have a higher education module, a public safety, there's fire and EMS, there's a veterans curriculum, and then of course there is an older adults curriculum as well. So those other modules are very audience specific. So if you know anyone that falls in any of those categories, they can also take that training that belongs to their audience. So here's the process on how to get trained. You would choose a date, whether you want to take the course individually. We have a lot of trainings on a consistent basis on our Eventbrite page, or you can schedule a training for your organization. You would just choose a date. We do ask that it's at least 30 days in advance. And then also know that you can split the training. So if you want to do the training in 2 days, we could come in to do, 3 and 4 hours, depending on your time frame. So we try to be as flexible as possible, depending on who we're training and what their needs are. Then you would pick the delivery option that you would be interested in. A lot of people are wanting training in person now, since we're kind of tired sometimes of the virtual space, but we still do trainings virtual. And then of course I spoke about that blended option where people would do the pre-work of 2 hours and then the remaining course online. Keep in mind that there is a training size. There's a minimum of 5. I always say I'd like a minimum of 10, only because with 10 or more people, you can still have a good conversation around the topics. And there is a maximum of 30 people per session. So it's a minimum of 5 to 10, and then there is a maximum of 30 individuals. We do have the capacity to have multiple sessions going on at once. A couple of years ago, we did a huge initiative with SAISD, San Antonio Independent School District, where we taught over 800 educators all in one day. So we have the capacity to, do as many trainings as needed for a one day. So if you or anyone is interested in, taking this training, reach out to me. My name again is Karen Coleman. My email that you can reach and let me know that you're interested in taking any upcoming session would be mhfa@chcsbc.org. And then, of course, you see our phone number listed, that 210-261-1114. At this time, I will take any questions if we have any.
So you can chat in any questions you have. You can also ask to come on screen and ask a question live if you would like. And someone asked if there's a cost for, I don't know if you can see the chat, but someone asked if there's a cost for the training, Karen.
So we encourage you to reach out to us because currently the local mental health authority has funding available for qualified individuals. So, and depending on whether or not you work for nonprofit organizations, there's a different rates, but we do have a lot of funding to provide the training at no cost currently. If you're an educator here in San Antonio, educators, anybody who interacts with children, I know attorney and judges, fire and EMS. So there's a group of individuals that can qualify for taking this training at no cost. So you would just reach out to us and let us know. We'll ask questions to see if you fit that criteria first.
And in addition to lots of thanks and for a really wonderful presentation, Karen, a couple of other questions. Besides SAISD, are there any other school districts with whom you all have worked to do this, the mental health first aid training?
Oh yeah, for sure. So we did the huge initiative with SAISD. We're actually about to do another one with NISD, Northside ISD, on November next month. There's also other ISDs that have taken the training. I know we work with NEISD, East Central, Harlandale, Edgewood. There's a huge list of ISDs that we work with, but I just mentioned SAISD because they were one of the ones that did the huge initiative for that day. Also, any universities in higher ed, they also qualify to receive the training at no cost. We currently have funding for them to take that training at no cost. So charter schools and private schools also qualify for that as well.
Thank you, Karen.
Mm-hmm.
And the question about whether it's better to use the QR code to register or reach out to you directly through email.
Either one, the QR code will lead you to our Eventbrite. However, if you fall under one of the categories for a no cost, email me first so I can provide you with a promo code. And that way, when you go on the Eventbrite, you'll have that promo code to enter that. Enter the promo code to receive the training at no cost. So just email us and let us know what organization, if you're interested in your organization as a whole taking the training. You can also point me in the right direction, somebody that I can reach out to that we can have a conversation. I can come in to do lunch and learns or have little, small discussions about what the training entails. Because a lot of people don't necessarily know that this resource is available. So we want to spread the word and make sure that people are aware that, we can come in and do this.
Great. A couple more questions for you. Mm-hmm. One related again to the no cost piece and what the criteria are in order to be eligible to have the training for free.
Yeah, so you would just have to fall under one of the categories that I mentioned, either be an educator, somebody who interacts with children on a consistent basis. So even if I will consider that as if you have a child, you're working with, somebody on a consistent basis. If you are a first responder, you would receive that at no cost. Private schools, higher ed, anybody who is an attorney, a judge, just reach out to me and I can provide you a form that you can fill out yes or no to see if you qualify to any of those criterias.
Great. Thank you, Karen. We had another interesting question here, which is if you go to a university for this training, do you recommend and are students eligible to come to the training so they know how to respond to their peers?
Yes. So like I said, anybody is available to take this training. I would love if we could get 100% of our Bexar County, population trained. So yes, it is available to anyone at the university. We can train not just the staff, but also the students as well. I know there are some universities that are making it a requirement for the students to, especially those that are going into the teaching field. So the education department is requiring students to take this training prior to them going to the school system. So yeah, I encourage anybody to take the training.
That's great. Thank you, Karen.
Mm-hmm.
I think that's all we have for questions in the chat. We'll just give you a couple more minutes. We're a little ahead of schedule here, so we get a slightly longer break and maybe have a chance to eat some lunch. But any follow-up questions for Karen? Okay, well, I hope you had a chance to look at the chat. There were a lot of And there are a lot of grateful folks for the information that you shared. So practical and really can have such a great impact on people's lives that we really appreciate you taking the time. And
Thank you. And
well,
I always emphasize, you know, although many people take mental health first aid as a training opportunity through work, it really is a tool that you can use with your family members, with your friends, with your loved ones. So it really is very valuable and impactful, not just in the workplace, but also for us having the conversations with our family members. I often find that some of the hardest conversations are with our close loved ones because we don't want to see them in that space. We want to get them out that little funky space that they're in. So we sometimes forget what, you know, the things that we might know on a professional side. So this tool really helps you navigate and remember what that process should look like.
Thank you so much, Karen. And thank you all for joining us as well. I just want to give you a little bit of instructions. So we are on a break until 1:15. The next sessions will start at 1:15 promptly. You will be able to get into the sessions 5 minutes before they start. You can, as I said earlier, you can go to the schedule, find the session you're interested in, click on it, and it'll take you right into the virtual room. And please keep coming and keep asking your questions. And thank you to Karen. Thank you to you all. Enjoy lunch if you're going to have it now, and we'll see you again soon.
Thank you.
Bye, everyone.